can you let me know, Dr. George, are there any specific areas of concern to your patients that we might need to pay more attention to that might relate to the treatments that we give them?
One of the areas that I feel like we're not really addressing is sexuality. Many patients who've been on hormonal therapy, because it affects, it turns off estrogen, it causes a lot of symptoms that decreases their libido, causes vaginal dryness. As a result of that, they don't want to engage in intercourse or they don't want any kind of foreplay or anything. And it really affects a lot of relationships, especially in the young population. And I have spouses complaining to me, and they don't want to increase the risk of their wives having a recurrence of breast cancer, but also they feel like they are not getting their sexual needs met as well. So it's been difficult trying to find solutions for them. So I often have to tell them, have a discussion with your medical oncologist. Let's see what options that could be done. There are different types of hormonal therapy. Maybe there are alternatives that they can try, see which one is more effective and have less side effects. I also recommend organic coconut oil for moisturizer for vaginal dryness, and a lot of my women use that and loves it. But the libido issue is really trying to increase their libido. Some of them, not everybody's affected with libido, but for those who have low libido, I find the younger population get hit with the low libido a lot.
I think that this is part of a really big area of survivorship. We have effective treatments, but they can cause side effects. And then our patients need to live with those side effects. So, what I tell my patients is that it's really important for me to know what's going on. It is also important for the oncologist and all our team to ask the question so that patients feel comfortable explaining how they're feeling on these treatments. I agree with you that there are certain simple measures that can be undertaken, and we also refer sometimes to experts in this area, for example, physical therapists with expertise in this area who may be able to assist. And in the end of the day, we really always have to weigh up the pros and cons. We may use a treatment to try and prevent the cancer from returning, but if it makes the patient's life very difficult, sometimes we have to pull back. And sometimes that's okay. It's a conversation that has to be had because we don't want patients to be uncomfortable day to day. So we just have to weigh up pros and cons with all these treatment approaches.
So it's very important that the patient have this conversation and don't feel that there's no alternative.
That's right.
Communication is the key.